I'm Joe Rose. I'm an internal medicine doctor. Some folks would call me a hospitalist. Basically, I work at JRMC and admit for your primary care doctor. So when you get sick, unfortunately your primary care doctor is not there. So he kind of hands the ball to me and I admit you for him and kind of act in his place. A lot of folks are curious why we even need hospitalists. They would like to see their own primary care physician. About 10 or 15 years ago, that kind of all changed. I think the lifestyle of the primary care doctor just got a little too complicated, having to be at the hospital at 6 in the morning, back to practice, and then back to the hospital at 6 o'clock at night, and not getting home till 10. Probably weren't as efficient in their care in both places. And as the demands for hospitals to have higher quality just continued to rise, they realized that they kind of needed to separate inpatient and outpatient. So that's kind of what made that distinction. So your primary care doctor just does outpatient now, and he does a really good job at that, and all I do is inpatient now. So the bad thing about a hospitalist is that I'm not your primary care doctor, the person that you know. And definitely understand that can be a little anxiety provoking, but know that the good thing about me is that I'm here all the time, here 24/7. Your primary care doctor is just a phone call away, so I can call him up and ask him anything I want to about you. And the second we take excellent care of you here, I can call him, let him know what we've done. So the continuity of care is good, and you're in good hands. A lot of folks come in and are curious as to how we'll know about their medicines, their past medical history, that type of thing. One, a lot of times our primary care doctors will call us and tell us that on the phone, or we'll call their office and get that information faxed over. The patient typically knows pretty well, and we'll always do a pretty in-depth interview with you and get what you know about your health history. Pharmacists are here too. They'll call your pharmacy and make sure we have your medications right. Nurses will go over that with you. So we've got a pretty good system for making sure that we know everything about you. The only way you're going to see me is if you're in the hospital or if we see each other in Walmart. It's just, unfortunately, I do not have an outpatient practice. I'm only in the hospital. So when you leave here, you follow up with your primary care doctor. So usually a week after you leave here, you'll be in their office so they can get caught up, make sure they know everything that happened, and make sure there's nothing else that needs to be done. The hospital doctors have an interesting schedule. We work 7 days on, and then we have 7 days off. So we work 7 long days in a row, and so you'll have us that whole time. If your stay goes beyond that, then one of my partners will come in and see you. And then, so at most you should have 2 doctors. There's that rare patient who stays in a month, unfortunately, but again, you'll just see those 2 as we switch back and forth. Now, if your family doctor ever wants to get a hold of us, honestly, I've met most of them. I've been to their offices. They have my phone number. They know exactly how to get a hold of me. So they can get a hold of me at any time, just by phone or by paging. So another good thing about a hospitalist is that we not only know the hospital very well, we know all the staff, including subspecialists. So if there's anything I feel like I can't handle, we've got cardiologists, pulmonologists, lung doctors, kidney doctors, surgeons, you name it. We know them all. We know who to call for you. So you know, you're in good hands. One other thing that's really good here at JRMC is that we have a SpectraLinks phone that is in my pocket at all times. So if your primary care doctor wants to ever get a hold of me, he just dials that number. I'll excuse myself from wherever I'm at, pick it up and talk to him. So a unique thing that we have here, and the primary care doctor is definitely like that. In general, what is a hospitalist? I'm kind of your primary care doctor away from home. Honestly, I think we understand that you're scared to death when you're in the hospital, and it's not a fun place to be. We understand that, so our desire is to, 1, take good care of you, 2, let you know exactly what's going on, and understand the process so that you know where we're going, the fear is not so bad, and just for you to know that you're in good hands.